Welcome to Health is Life. We'll begin with this special reflection from Tanzania.
At DCMC, we normally start with devotion because we believe that the strength that we have to providing services to our patient comes from God. And we receive different kinds of patients. I will put it in the form of a little song. Why should I feel discouraged? And why should the shadows come? Why should my heart feel lonely and lonely? In forms of those questions that comes into the song, that is how our patients come to DCMCT. They are discouraged. They have shadows. Their shadows can come in forms of different sicknesses. And when they come to DCMCT, they hope to receive services through our good customer services, through the available medicines, different doctors in different services. And when they leave the DCMCT, they have a big smiles on their face. They are assured that when I leave my home going to DCMC, I'm going to feel happy. I'm going to meet people who are friendly. I'm going to feel like a family. And that is when I sing with you that I sing because I'm happy. And that is how I know that my patient, when they come to the dispensing room, the dispensing window, when we exchange, we give medical medicine instructions. You read their face, you look at them, you talk to them. And when they leave there with that smile, that healing, that feeling that I've served, I've given service to a patient, they are happy. They live with their medicine. They live happily. And after 1 month, after a few months, they come back to you, they say, Miss, the last time I was here, I received very good services from you. And today again, I hope to get the same service that I got last time. Thank you and God bless you.
Hi, good evening. I'm Ann Hushen, Executive Director of Dodoma, Tanzania Health Development. Welcome, thank you, and good health to everyone tuning in tonight throughout our world. This new and different virtual format is certainly not how we expected to meet with you this year. But it's been a different 2020 for our world, and we're just so grateful we can bring you closer to our mission like this and share the impact you can and do have. I'd like to give a very special thanks to our sponsors who've stuck with us through many changes this year. Thank you. We are Dodoma, Tanzania Health Development. Our mission is to support Dodoma Christian Medical Center, located in Tanzania's capital city of Dodoma. The medical center is considered a shining star of healthcare facilities. Just in the past year, nearly 100,000 patients received care. And it's the hospital's high-quality, compassionate care and the medical team's commitment to seeing every patient who shows up, even into the late hours, that has made the hospital the facility of choice for people in the area, especially for safe childbirth, dental care, and more. You and I all want and deserve the best in healthcare when we need it, and so do the people of Tanzania. After all, health is life. Last time I was there, I met this new mother, Neema. I was surprised when I learned it was she who was being discharged, not her baby. Neema had gotten sick about a month after her delivery and needed to be admitted again. When I saw her, she was so happy to be going home and so happy to have been cared for at DCMC. Later tonight, you'll be hearing from Dr. Gasper Msange, who says it best. DCMC is small in size, but mighty in impact. The needs of this medical center are tremendous, and the more tools and resources we can provide, the more lives we will all help to save. Tonight, we ask you to join us in raising $200,000. Your gifts are an investment in the life-saving work happening at the medical center every single day. The coronavirus has impacted everything at the hospital this year. Just months ago, it was all about protecting staff and patients and avoiding the spread of COVID-19 at the facility. Much like we saw here in the US, elective surgeries were halted, clinic hours were trimmed to reduce patient flow, mandatory hand-washing stations were added, temperature checks became the norm. The entire building was sterilized every night, and so much more. During all this, healthcare resources became strained and cost to operate went up. Thanks to gifts from you, including the Medtronic Global Health Fund and In Faith Community Foundation, the hospital was and still is able to obtain the PPE supplies they've needed. The country is now resuming a level of normalcy, and so is the medical center. In the end, they were not overrun by COVID-19 as they expected they might be. A not too small miracle for which they and we are so tremendously grateful.
The biggest challenge that we had this year at the beginning was the COVID-19. COVID-19 also affected our country and Dodoma, and we received patients also at DCMCT. We thank God that our staff remained healthy, and we also thank God that we managed to buy quickly the PPE to protect our staff and the patients. We thank the donors for facilitating this, and we were able to protect ourselves. COVID-19 affected part of this country, but we also had a number of cases. Our hospital was not overrun by patients, and those who came to us received proper treatment and got out of the hospital.
COVID-19 notwithstanding, there have been many miracles, big and small, every day, thanks to your support. More than 40,000 patients have been cared for so far this year. More than 9,000 mothers and children have followed through on prenatal care, well checks, and vaccinations. More than 3,500 dental patients have been served. Over 800 surgeries have been performed. All 113 staff members have been able to continue working, and everyone has remained healthy. Electronic medical records were installed. As we speak, the community health outreach team is just starting to get back into rural villages, and the dental team will soon be back doing screenings in schools. This fall, a newly built pathology lab will open, the only one in the entire region. And around the corner in 2021, there are plans for a new surgery wing and ophthalmology services. All of this will be transformative for the region. And of course, there are the babies. More than 500 of them have been born so far at the hospital, half of which have been high-risk deliveries. Parents keep bringing those babies back as they grow, too. Here's one of our little miracles, Joran. His mother brought him in because he was extremely lethargic. It turned out Joran was severely anemic, and after just a few hours of IV fluids, he was already feeling much better. When I saw his mother, she was overjoyed and thanked DCMC profusely for saving her son. Let's take a closer look inside the medical center.
Why should I feel discouraged? And why should the shadows come? Why should my heart feel lonely?
DCMC, the Dodoma Christian Medical Center, is a hospital in the city of Dodoma. It started as a small hospital. Now we are growing. People here work very hard, especially myself and the staff. But what makes me happy and proud of this institution is that people like our values, and they get the quality of care that they expect to get in this hospital.
Most of our patients when they come here, especially women and the children, they want to be treated here. Sometimes we ask why, because like we don't have beds, we don't have enough space, because our hospital is only 50 beds and most of the time is full of women and the children. We try our level best to make sure everybody is comfortable. On delivery, because they know of our care, our quality of care, even our nurses, they speak really good, taking care good when they are in labor ward. So most of them, they come to deliver here. Our labor ward is only 2 beds. Sometimes we have to find another place to make delivery. So really, we love our job, we like our professional, and we love our professional.
It's a place where most of the sick kids and also unhealthy kids come to seek for treatment, also for counseling and health education about taking care of their children. I see at least 25 to 35 kids who are sick and those who are not very sick in a day. Therefore, it's a bit busy. And with that, despite of the clinic, I also visit patients or see patients in the wards when we are doing ward rounds. It's a very challenging place because there are many kids, since I'm the only pediatrician who is around at the place. And most of them are coming after visiting several health units around the town, also outside the town.
But we're also thankful for the partners and the donors that provide us this equipment, and they work with us in partnership with us. And it is very encouraging that we can do so much to the patients given the limited space and resources that we have. And we also feel proud that when they come, in Dodoma, everybody who comes in Dodoma, and when they ask where can I get the best treatment, they say go to DCMC.
I'm happy and I'm satisfied to work at DCMC because it's a place where you can get most of the things, equipments, medications, and everything which you need to help these kids.
I am a urologist. I was born in Tanzania. I was lucky to be trained in the US, and I'd like to give back where I came from. That's why I come here. DCMC is a small institution, but it's got a great impact in this community. The quality of care that is provided here surpasses every other institution around here. There are bigger hospitals around, but patients would rather come here because they get quality care. It's small, but there are big dreams. So we need support to make those dreams come true.
Tonight's featured speaker is Dr. Gaspar Msangi. Dr. Msangi is a native Tanzanian who went to St. Olaf College and received his medical degree from Mayo Medical School, all right here in Minnesota. Today, he's a urologist in Atlanta, and in the past few years, he's brought his skills back to his home country as a volunteer at DCMC. Welcome, Dr. Msangi, and thank you for joining us. If you could start by telling us about your background. What was it like growing up in Tanzania, and why did you want to become a doctor?
Thank you, Anne, for this opportunity, and thank you to our audience joining us wherever they are. I was born in Dar es Salaam, Tanzania, the sixth of 9 children. I come from a big family. And my parents did small-scale business, and one of the businesses was a duka, a small store where we sold everyday items. And the whole family chipped in the different chores that were needed to be done. My parents insisted on education, and I remember the first classroom that I went when I was in preschool was a small room. We'd start on the floor on cement blocks at times. And but the most educated person in my family was my uncle, who everybody called Dr. Shabani. In actuality, he wasn't trained as an MD, but he was the one who provided care to a lot of people in his village and surrounding villages. So that title stuck with him. And I always wanted to be like him. And I begged my parents to allow me to go live in Kenya where he lived. And so from 2nd grade to 8th grade, I was in Nairobi, Kenya. And after that, I came back to Tanzania to do secondary school. And when I heard about scholarship opportunities, I applied and started my freshman year at Waldorf College in Forest City, Iowa in 1997. I was there for 2 years and then moved on to St. Olaf, where I was there for another 2 years for my bachelor's degree. I was lucky to join Mayo Clinic as a medical student, and I was there for 4 years. And then moved on to Beaumont Hospital in Royal Oak, Michigan for my training in urology residency. And after graduation, I've been working here in Atlanta since.
Can you share with us what you see and experience when you're at Dodoma Christian Medical Center? And what draws you there as a physician?
When I'm at DCMC, I am reminded of why I went into medicine in the first place. You see, DCMC is like a little family where providers are providing care to their fellow family members. I have that feeling that it's like we're in this together, and they provide service that is compassionate and of high quality to people who need it most. You should see the day start with morning devotions and providers wishing each other a successful day, and they move on to provide care to their patients. This is very inspiring to me. And they are able to provide care and give and have good outcomes despite the limited resources that they have. Here in America, I'm able to enjoy a lot of things that I do without when I'm there. Here, my surgeries, I have a whole surgical team with lots of people who help me behind the scenes. But there, I don't have always, gloves that fit or instruments that are perfect for my hand. But physicians there are able to work and have great outcomes for their patients. So that culture of service and giving is what really inspires me when I'm there at DCMC.
Tell us, what does a medical center like DCMC mean for all those thousands of patients in the Dodoma community?
See, DCMC is a small hospital that provides high-quality, compassionate care. In Tanzania, we don't have the culture of scheduling clinic visits before going to a doctor. Most people, when they get sick, they will go see their doctor, usually at a hospital. They would wait in line to be seen. And depending on how many people are ahead of you, you may not even get to be seen that day and have to come back the next day to try again. It's a little different at DCMC because doctors would stay late to see their patients. It's almost guaranteed that if you make it there, you will be seen. I have seen my host, Dr. Nyamba, stay late just to finish his clinic. In many hospitals in Tanzania, because of the shortage of doctors, because of the compensation of physicians, sometimes physicians have to work in more than one hospital just to make ends meet. It's a little different again in DCMC because most of those physicians who work there work only at DCMC and they're fully dedicated to that hospital. DCMC may be a small hospital, but it is a giant in the service that it provides. And you can look at the parameters. One of the parameters you can look at is infant mortality and maternal care. There's such excellent infant and maternal care that the mortality rate is very low comparing to many parts of Tanzania and Africa in general. The service at DCMC is exceptional. I remember the last time I was there was a little boy who was brought by his father. They had traveled all day. We saw him in the clinic late in the evening and examined him, and I determined that he had hydrocele and he needed surgery. We booked him for surgery the next day, and I was ready to discharge him, but I had to stop and pause because of the circumstances surrounding this case and, in general, the people in this region. The father couldn't read or write, and we were worried that he may not be able to dispense pain medications appropriately. Who's going to do dressing changes for this young boy? You know, he was healthy. We didn't want to send him home only for him to get an infection and completely change his life, maybe even take his life. So we decided on keeping the patient admitted. He was there for about 2-3 days until he got better, and then we allowed the father to take him home. So this is the kind of care that you are almost always guaranteed to get at DCMC, compassionate care that is of high quality with good results for its patients.
How can everyone joining us tonight have an impact on the work of this medical center?
Thank you for that question, Anne. And this is the whole reason why we're here tonight. I would like everybody to join us in giving so that we can improve healthcare in Tanzania. See, when I'm there, we see a lot of patients. And I remember seeing maybe 8 to 10 of those patients who needed their wound dressings changed. Now, this is a task that a nurse can do, which would free up time for the surgeon to do more surgeries or see more patients. But training a nurse costs money. A lot of amazing things are happening in DCMC, and a lot more can happen. Because of the excellent care that DCMC provides, more and more people want to be seen at DCMC. This is a good thing, but it's also a problem because that means that DCMC has to expand in not only the volume of patients that it has to see, but also in the services that it has to provide. It would be nice to have more than one surgical suite so that the general surgeon and the gynecologist don't have to wait for each other, but patients can have surgery when it's needed. It would be nice to have a urology suite whereby I could bring specialized care that is desperately needed in this region. But all those things cost money. And this is where you come in. We can all give. Do not underestimate the value of $1. The little that you can give here goes a long way there. I remember when I just came to the US, and in the evening when we would study, my friends would order pizza. And I always would convert that money to Tanzanian shillings and see how much money it was. And I could never bring myself to do that. Because that $10 to $15 that we spent that night, if I converted it to Tanzanian shillings, it would feed my whole family, all 12 of us, 3 meals in a day, and still have money left over to do something else. That is how powerful the dollar is. So please give, however much you can give. Now, it costs only about $30 to do a delivery at DCMC. With just $30, you've directly impacted 2 lives. Can you imagine how much more of an impact you can have if you gave, let's say, $500 or $1,000? So there's need. And if you can, please give. There's a lot of disparities in this world, but people are waking up and want change. And a lot of us are trying to find ways to make this change a reality, but we do not know how. Well, here's your opportunity. Here's a way that you too can be a part of the solution. Not just stand by the sidelines and watch things happen, but you can be a part of this change that is trying to make the world a little bit more just, a little bit more healthy. You can give. Please give to DCMC and have an impact in people's lives and make this world a better place.
Thank you, Dr. Msangi. You heard it from him. Do not underestimate the value of your dollar. With hundreds of people coming to the medical center every day, some unable to pay anything at all, they really need our financial help. As I mentioned, our goal is to raise $200,000 tonight. We've already received early commitments nearing $80,000, so we're well on our way. And with your support, we can get there. Now is your opportunity to help DCMC provide patients with the quality care they need and deserve. Click on the link in the video description to give right now. We welcome gifts online, and you can also find us on Venmo and Cash App. Checks can be mailed to our office. If you ever have any questions about our mission or want to talk more personally about your giving, please call us. Thank you again so much for joining us in this virtual event. It means the world that you've taken the time to hear our story. We'd like to close our event with these expressions from Tanzania.
We thank you all our donors for supporting us during this time. This year was hard, but we managed to go through successfully, and we thank you for your support. Thank you very much.
Asante.
Thank you. Asante sana.
Asante.
Thank you. Asante sana.